Stand by, we're going in 5, 4, 3.
Good morning, Trinidad and Tobago. Welcome to the premiere episode of Ask Dr. Antoine. So if anything is bothering you medically, if you have any questions, what you have to do, ask Dr. Antoine. But this is not about me. This is about healthcare, improving healthcare in Trinidad and Tobago and across the Caribbean. And again, welcome to the premiere episode of Ask Dr. Antoine. We're here this morning to celebrate Dr. Marsha Lee George, a sister of the soil from Trinidad and Tobago, but she currently practices in the United States of America. She is a nurse practitioner, the only nurse practitioner who will be the first to be licensed in Trinidad and Tobago. Dr. Marsha Lee George is the clinical director of the Stroke and Diabetes Center located at Piarco Plaza in Trinidad and Tobago. So Dr. George, welcome home.
Thank you. It's great to be home.
Well, that's good.
It's so nice to be home.
So now this is just lineman. We just lineman with Dr. George. We're having a medical line today, and we're going to keep it real. We're here to bring you facts, figures, everything. So this morning we're here to, Dr. George just published a book with Dr. Kimlin Ashing out of City of Hope of California. She's a psychologist, and Dr. George is a nurse practitioner. Dr. George is a nurse, doctor, books writing, the whole works. And she truly is one of Trinidad and Tobago's elite academically, with lots of ideas. You know, a lot of your ideas have cost me money, right?
Yes.
Yes. But I like that. She brings out the ideas. So yes. Dr. George just published Detecting and Living with Breast Cancer for Dummies, published by Wiley Publishers,
yes.
Right? So Dr. George, how does it feel to be back home?
It's great. And the more I spend time here, I realize there's so much work for us to do. There's so much we can do to help our country under healthcare, especially cancer. You know, like cancer is like an epidemic. People dropping like flies in Trinidad. It's unbelievable. You know, when we think of breast cancer and prostate cancer and colon cancer, it's just astronomically high. And what's sad about it, a lot of it, we can prevent it. A lot of it, we can educate. We can do lifestyle changes. We can be more informed and hold our medical professionals accountable. But the only way we can do that, we got to educate the public, and we got to re-educate medical professionals as well.
Now, Dr. George, I do a lot of community outreach programs. And it's not that I do it. My team does it at the Stroke and Diabetes Center at Piarco Plaza.
Yes.
So we go out to churches and communities, and I'll tell you, this is funny. Young women out there, 40 years old, in Trinidad and Tobago, and I go out to some rural communities. I say, hey, when is the last time you had a pap smear? She said, this young woman in Grand, she says, Dr. Antoine, you know what it is to do with pap smears? I said, of course I know what it is. She said, my husband don't like that. Now, how do you educate a 40-year-old woman who's had 3-4 kids to have a pap smear, do a breast exam? There's so many people who don't know how to do a breast exam. I'm really good at drawing the pictures now, right?
Yes.
Since medical school, I've drawn these pictures and I show them how to do a breast exam and how to do it correct. How do you go about educating us? Because you know, Dr. George, our people are dying, and we are here to end that. So how do you educate these young women, these young men, about cancer and doing the screening tests and educating young doctors? They have to educate people to do these tests. How do you go about doing it?
Well, first of all, you know, a lot of the medical doctors, they're uncomfortable examining a woman's breast. You know, a lot of primary care or general practitioners would do a physical exam without touching the woman's breast. So we have to break that barrier.
Is that a physical exam? That's like you could do that on the phone then.
But a complete annual physical exam do include a breast exam. It does include a digital rectal exam. And if your general practitioner is not incorporating that, or if they feel uncomfortable doing the DRE, at least they should send you to a urologist to do it. But to ignore it and don't discuss it, you know, that is suicide. The other part about what I notice with a lot of my women and men, I tell them, I say, you know, sometimes when you're in love making, you have your husband, you have your wife, you know, I teach the men how to do breast exams on their wives. And I teach the women how to do breast exams on the men, because men do get breast cancer. And the little dainty touching and all of that, that don't work. You gotta get close and personal with how your breasts feel. I use something I call the dough method. You know when you're kneading flour? That's how you have to squeeze the breast and feel it, because you gotta know where the lumps, the bumps, and everything is. Because when you do your breast exam, you're really feeling for what is your normal. If you know your breasts, then a couple months later down the road, if something pops up, like a mass somewhere, skin thickening, you would be the first one to recognize it. And that would be your cue to go to follow up with the doctor. But if you never did your breasts and you feel something, you don't know if it was there all the time or you don't know if it's new.
So what about the woman who's well endowed per se and have larger breasts? And she's like, well, I can't feel all that, you know? What do you say to her?
Well, a lot of times the best position for well-endowed women is to lay down flat on the bed, put a pillow mid-back, so you arch it like that, so you have a wider chest circumference, and you really use your arms and you feel, you know, you get really deep in that. But if you're uncomfortable, having a clinical breast exam once a year is very good, and a GYN, a gynecologist, can really help you with that. Plus, doing your mammogram as a screening tool starting at age 40, those double checks gonna help you to determine if something is wrong in your breast.
But let me ask you this. I was trained in the States. I went to a decent medical school, right? And they, you know, it's been a while. I don't do a lot in my practice. I just retired from the US Army on October 1st, 2016.
Yes.
Right, did a couple tours in Iraq and Afghanistan. And I am not the breast examiner extraordinaire. But my question to you is, because we're talking facts here, right?
Yes.
We're talking, what we call in the States evidence-based medicine. They're saying, you know, evidence-based medicine, things you can get in trouble for if you don't follow the recommendations.
Yes.
I have read many times where the age for doing a mammogram is 40. Next year is 45. Then sometimes people would say 50. And here's the question. At what age do I need to start recommending breast mammograms for my patients?
Well, that's a whole controversy, and I'll tell you, I have to give you a little background in that. The United States Protective Task Force, about 3 years ago, wrote a report stating that women should have breast exams, screening mammograms at age 50, and then every 2 years after that. And
Positive or negative? Either way.
That's what was
2 years.
Well, yeah, 2 years. However, we looked at Johns Hopkins Breast Center. We went back into our cancer registry.
Yeah.
For that same year, we had about 300 women between the ages of 40 and 49 that was diagnosed with breast cancer that was only seen by mammogram. So if we really follow the United States Protective Task Force, that suicidal woman would be dying. So now, who wants to be liable? You know, in the US, it's a litigious society.
Absolutely.
You know, so a doctor don't want to be the one to tell the woman, go have your mammogram at 50, because if she does have breast cancer at 45, she can go to court and sue his pants off and win the case. For women that have a first-degree relative, like a mother, a sister, who've been diagnosed with breast cancer, they need to start screening mammogram 10 years younger than the age of that first-degree relative. So if your mother had breast cancer at 43, you need to start having mammograms at 33. And a lot of times in Trinidad and Tobago, that is not happening because the information is not out there. Because that tells you that you are at a higher risk than the average population to developing breast cancer.
Let me tell you this. Last night, for some strange reason, you know, I run an organization called Caribbean Medical Providers Practicing Abroad.
Yes.
It's a collaboration between the Caribbean Medical Fraternity and the Caribbean Medical Diaspora.
Yes.
So we bring a lot of Caribbean doctors home to help out, right? To give back, per se. So a young woman popped into my life last night, because all last week, because I believe in the power of the spoken word. That's how I've lived my life. So recently I've been saying, Lord, we need a dentist in the organization, because there was an organization here a few months ago, they had a dentist and he was doing phenomenal work. And I've been saying, Lord, we need a dentist. Lord, we need a dentist. And suddenly a young woman who was in my life 30 years ago, probably the main reason why I'm a doctor, saw me on Facebook and contacted me, and lo and behold, guess what she is?
A dentist.
A dentist. And her name is Ginger Farrow, right? And I haven't spoken to this woman in about 10, 15 years, and before that, another 15 years. But she's a dentist. She has Caribbean heritage. And I was talking to her last night, telling her what we're doing, and here's what's going on. This young woman, Ginger, she's Dr. Farrell Williams. She said to me, "Oh, Dr. Antoine, Jared, I was diagnosed with breast cancer a few years ago and had a double mastectomy." I was like, "What? A double mastectomy, Ginger?" She said, "Yes." I said, "But why if you had cancer in one breast, why would you want to have a double mastectomy? What would cause a young woman, even if you don't have the number one gene," and I don't think she had the number one, the dominant gene for breast cancer.
That's BRCA1 or 2, yes.
Okay, she didn't have that, but she still went ahead and had the double. What would make, and here's what she told me. She says, Jared, here's what. I didn't want to have an 18-year-old breast and a 50-year-old breast. So she went ahead and did both. What is this thought process and the decision-making thought process for a young woman who's been or older woman, middle-aged, it doesn't matter, to have a double mastectomy if you've just been diagnosed with breast cancer and just have the gene? Can you not get away with a lumpectomy? Can you just get away with radiation?
So there's two sets of patients we're talking here. We have the patients that's high risk, who may have the breast cancer gene mutation, the BRCA1 or the BRCA2. Definitely, according to the NCCN guidelines, the recommendation is to have...
What is this NC? What is that?
That's the National Cancer Comprehensive Network, and that is who sets the recommendations for cancer treatment in the US, one of the body, as well as ASCO, which is American Society of Clinical Oncologists. So according to the guidelines there, they recommend that if you have that gene, we recommend a bilateral mastectomy because you have over a 75% chance of developing breast cancer in a lifetime. So even if you have it once, you're going to have it again. That chance is still high for the other breast. But we have a whole lot of women, mostly younger women, like in their 40s and under, are choosing double mastectomy. Even if they have a ductal carcinoma in situ, which is an early stage breast cancer where the cancer is still confined to the ducts of the breast and there's no invasive cells that spread out. You can safely have a lumpectomy and survive a lifetime with that, but they are still choosing mastectomy. And sometimes we treat the fear more than the disease, because what makes a woman decide to have that is that they don't want to have this experience again. Because a lot of them have young children. They're working, they're professionals, they have so much activities going on, and they had to stop their life to treat this cancer. And sometimes that treatment could take anywhere from 6 months to a whole 12 months. And after you've been through that, you lost hair, sometimes you get radiation, you deal with the side effects. A lot of times they don't want to go through that. And then nowadays, people are getting more educated. And some people said, you know what, I don't want radiation. And if you don't want radiation, then the only obvious choice is a mastectomy. You know, so these are some of the things. But the other option is that some women know that if I take one breast off, I want breast reconstruction. So I want a belly. I want my belly to be flat.
Do everything at once.
Do it right. So if we're going to do breast reconstruction using the fat, which is a deep procedure, the fat in the belly, we can only touch that area one time in a lifetime. So they're like, if you're going to touch it once, you might as well do both. Okay. So that's the thought process.
So that's the right answer for, I guess there isn't a right answer. This is a personal decision that one has to make. So we'll take a little break and we'll come right back with Ask Dr. Antoine.